Hello, I am from HoursTV and today we are here with Dr. Shahzad Mirza. Hello, doctor.
Ji, hello.
Would you like to tell us about yourself?
My name is Dr. Shahzad Mirza and I'm a graduate of Dean Montmorency College of Dentistry, and I've done my Masters in Aesthetic Dentistry from King's College London.
Okay.
About myself, my father is a dentist, so that's where I've become a dentist. He wanted me to become a dentist, so it runs in the family. We've been in this business for 45 years.
Okay.
He's been the dean of Dean Mont, and then he moved to private institution. He was the dean the dean of FMH, Fatma Memorial Hospital, and that's about me. And I practice dentistry. Not the way most of the dentists are doing. I'm in modern dentistry, which is probably the most non-invasive dentistry. It's called minimal invasive dentistry. So myself and with my team here at Dental Aesthetics, I am working under my father's supervision. So we have all the departments of dentistry which are practiced here.
Okay, so what services you are offering these days?
We offer all the services in dental practice, starting from from children problems to adults. That includes minor surgical operations and any toothache, any gum disease, any static area, any cosmetic area, even the facial aesthetics we are doing here. So we are covering most part of the dental procedures which are taking place. We have a vast experience and team. Every field of dentistry is covered with a specialist. So it's not that we're practicing, one person is practicing all the fields of dentistry. We have a specialist for every field of dentistry. Starting from very kids to adults, to smile makeovers to facial aesthetics, and if there is any disease, like any pathology, like there is a trauma or there is any cancer related stuff. So we have specialists and we offer most of the dental services under one roof.
Okay, so we hear that the A team are super dentists. How do you outstand yourself among other dentists?
Super dentist.
Yeah.
We are super dentists in the way that we are practicing the modern dentistry. We are not now we are not practicing the old dentistry, which has also most probably been erased from the rest of the world. Most of our dentists who are trained in Pakistan, they follow their mentors who are probably trained and worked in Pakistan. But as obviously I've been trained in UK and other areas, and I do a lot of CPD, which is continuous professional development. So I practice modern ways of dentistry. That includes the minimal invasiveness everywhere in the world. And the world is following another path, and Pakistan is moving another path. So we need to focus on how the world is moving. So that's how I call myself a super dentist, because we offer what the world is offering, and that is the best in the world. And all the technology-wise, the material, the technology, everything which is being used in the world is being used here in our practice.
Okay, perfect. So how do you manage to achieve customer satisfaction?
How do I manage to achieve customer satisfaction is how we treat them in a way that I would treat my brother or sister or anybody who's sitting on the dental chair is probably related to me. In the sense that if I can treat them as my mother or a sister or daughter sitting on the chair, that is how I treat them, and their pain becomes part of my treatment. I want to get rid of their pain, alleviate their pain. That's how I treat them, and I do not tell them what I cannot do.
Okay.
So that's the best thing about our place is I cannot achieve miracles. I can do my best and hope it turns out to be the best treatment for them. It's this practice is actually based on research which has been done all over the world. It's not a hit and a miss trial kind of a practice. We base our practice on research which has taken place, all the work which is being carried out in the world, and has been proven that it is the right way to treat your patient. That's how we treat our patients. Yes, obviously there are gray areas, sometimes it happens, but I'm not saying I'm a perfect dentist, but I'm saying my intent is to treat my patients as my family.
Alright.
So if you have that kind of behavior and you have that kind of staff who's more anxious to treat their patients in a very genuine way, then it works out pretty well.
Exactly. Okay. Top 3 dental issues you have seen in your tenure at DA?
The top 3 dental issues, mostly it's to do with pain.
Okay.
पाकिस्तान में बहुत से ऐसे issues हैं, they are pain related. Okay, so हमारे मुल्क में it's about awareness. Most of the people come to a dentist when they have pain. Okay, so pain is one of the most common reasons why one would visit a dentist. And why do you have pain? Because we do not know how to brush, or we are eating too many sugary stuff. In kids, in school-going kids, mostly it's the not doing their brushing and eating too much of sugar.
Okay.
So the kids come here for pain, and mostly they are in bad pain when they come to a dentist. So secondly, I get a lot of patients coming to me with loose teeth, like they have they have mobile teeth which are moving. So that is from 40 plus, and that is because they have gum disease. Okay, so why we have gum disease, again with brushing. So they're not brushing.
Okay.
And thirdly, why people come to me, because I market myself as a smile makeover dentist. So people come to me for aesthetics. So if a lot of people now are taking interest due to this internet. A lot of people see good smile makeovers, and they want to know they have spaces between their teeth, they have crooked teeth, and they don't look nice even though they have a pretty face or they don't have good teeth.
Okay, so what you have done recently to enhance your dental knowledge?
Okay, for me, I am always going abroad for my CPD, which is continuous professional development. And I look at the areas where I can improve on my aesthetic skills. I take a lot of international conferences and also hands-on workshop skills which are actually taking place. Recently, I've done facial aesthetics. I am already doing facial aesthetics for the last 5 years. I do Botox and I do derma fillers. I've been trained by dentists and obviously people in abroad. But I have recently done a PRP workshop, which is more to do with facial aesthetics, where we draw your own blood and we inject in patients' face to improve their facial appearance and rejuvenate their face. Also used for a lot of it is used in dental implants, where we can actually replace the soft tissue. So that is one of my areas where I always look to improve on. So this is always in my agenda to go for further improvement in my skills, which can help my patients and improve their aesthetics and otherwise in their dental procedures.
Okay, so do you actively market or depend on referrals?
I do a lot of marketing. And my dentists, they're not happy with me. My friends, they don't like me marketing so much. But I think it's all about marketing. I mean, it is healthcare, but I market with with new technologies. I'm marketing on social media. I'm on most of the platforms available on social media. I think this is the way forward. There's no way that you can wait and see and expect somebody to just walk into your practice. You have to sell yourself. So I sell my services, which are mostly just what I do. So I tell people this is what you can benefit from, and then they obviously see me through internet, through different sources of social media, and they obviously like them and they come.
Okay.
And then they obviously, once a patient comes, they refer other patients as well. That's natural. So yes, I do a lot of marketing.
Okay. So, any tips for the viewers?
Well, tips for the viewers. The best tip is to visit your dentist. चाहे आप मेरे पास आए या किसी के पास आए, make sure that you make a visit to your dentist. Especially for people जिनके अभी बच्चे हुए हैं, they should take their children. जैसे ही उनका पहला दांत आए, they should make a visit to a dentist. And afterwards, even for adults or school-going children, then once a year you should make a visit to a dentist. And then the second tip is to brush twice. Brushing is one of the most important parts of your oral hygiene. So brush once before going to bed, and then once in the morning when you get up. That's the other tip. उसके अलावा for children, school going children eat less sugar. Encourage your children to eat less chocolates and less sticky stuff, even fizzy drinks. Please don't let your children take fizzy drinks. Okay, avoid candies. Give them chocolates. You cannot hide, or you have to give them chocolates at meal time. So when their saliva is at the maximum, and then it can act as a buffer. So give them chocolates at meal times. Do not insult the chocolate. And even for the children who have pain and have swelling, I blame parents. It's a kind of a neglect that you've done. That your child cannot smile, your child cannot go to school, or your child cannot eat properly. So it's a neglect on the parents' part. So brushing, looking after your oral health, even for parents and other family members, whoever has a problem, dental problem, pain, must make a visit to a dentist. Okay? Do not let it sleep and then okay, chali gayi aaj, so let's wait and see if it's never come. It will come back. So make sure you visit a dentist. Just a visit can help you to get away with the pain. इस तरह हो सकता है कि if you look after your teeth primary care में, then you probably be better off rather than getting it extracted दांत निकलवाना पड़े. That's the best I think I can give you, that make a visit and brushing.
Okay, thank you so much, doctor. It was really nice meeting you. Thank you so much for sharing your experience, knowledge. Thank you.